Thanks for joining us here today, and thank you to Dr. Brent Roussin for being here with me this morning. And Brent, thank you so much on behalf of Manitobans for the tremendous work that you've done for us during this pandemic, and we'll continue to do. We all hope for not a lot longer, but nonetheless, we appreciate and thank you, and Lynette Siragusa as well for your constant efforts. First of all, I want to offer my sincere condolences to the many families impacted by the tragic events that have taken place throughout our province over the last number of months, and in particular at Maple's Personal Care Home this past weekend. The situation's heartbreaking, it's devastating. Parts of it are unacceptable, and our government is committed to getting the answers that Manitobans need and deserve. As well, specifically to all Manitobans who have lost a loved one to COVID or are battling this virus as we speak, our thoughts, our prayers are with you and with your family during this very difficult time. This year has been like no other. COVID-19 has handed us some new challenges and even greater challenges than I would say most of us have experienced. This virus has challenged each of us to become more resilient, more innovative, more determined than we ever thought necessary. And if COVID has taught us one thing, above all, it has taught us there is no profitability in blame placing. There is no short-term fix. There is no one-step action that can guarantee that it will not be coming back. Our number one priority through this entire process is protecting our most vulnerable citizens, and we are all vulnerable to COVID. And we must continue to ensure that our healthcare system is there for all Manitobans when they need it. And this is critical as we move forward. Today we're here to discuss new public health measures and new economic supports to help get us through the greatest public health and economic challenge of our lifetimes, COVID-19. Aujourd'hui, nous sommes ici pour discuter de nouvelles mesures pour nous aider à surmonter le plus grand défi de santé publique et économique de notre vie, COVID-19. Every province, from British Columbia to Quebec, has had their highest number of positive cases during the second wave, and all of them have been in the last few days. Manitoba is not immune. Like our neighbors across Canada and like every jurisdiction around the world, we have been chasing COVID for a while now. When we were abiding by the fundamentals, we were beating COVID. Then some of us lost our way. Now COVID is beating us. We need to get back to the fundamentals. We need to flatten our COVID curve, and we need to do that now. I believe, and I want Manitobans to know this, I believe profoundly that with the cooperation and assistance of all Manitobans, we can and we will get back to beating COVID. By taking these new measures seriously, we are going to save lives, we are going to protect Manitobans, we are going to protect our healthcare system when we need it most. En prenant ces nouvelles mesures au sérieux, nous allons sauver des vies, protéger les Manitobans, et protéger notre système de santé lorsque nous en avons le plus besoin. Brent, I'll pass it over to you for some news.
Thanks, Premier. Good morning. I'm speaking to you today with a crucial message. We are truly at a crossroads in our fight against this pandemic. The measures we've had in place over the last number of weeks, while restrictive, have obviously not been enough. We continue to see our numbers climb. We continue to see increasing strain on our healthcare system. In just 1 week, we've announced more than 2,000 cases. We've been pleading with Manitobans to follow the fundamentals, to significantly reduce their contacts, and but the numbers continue to climb. It's clear that further action is needed, and this action is needed now to protect Manitobans. We have that responsibility to ourselves, to others, to our healthcare system, to our healthcare providers, as well as to the vulnerable populations. We are truly in this together. We need to turn these numbers around, and we need to turn them around now. Our plans are that these new restrictions will help halt the spread of this virus, to protect Manitobans and ensure our healthcare system can continue to function. Today we're announcing that the entire province of Manitoba is moving to critical or red on the pandemic response system, and additional restrictions will be added to the critical level. This short, sharp set of restrictions to stop the spread of COVID-19 in Manitoba and to bring the entire province under the same restrictions. The following restrictions will come into effect on Thursday for all of Manitoba. There will be no social gatherings permitted. Social contact is reduced to members of your household only. Travel to and from northern Manitoba is restricted to non-essential, and non-essential travel is strongly discouraged. Retail businesses listed as critical services can remain open at 25% capacity. Those include businesses such as grocery stores, pharmacies, as well as others. Retail businesses not on the list can provide e-service, curbside pickup, or delivery only. All gyms and fitness centers must close. Sites that provide space for religious and cultural gatherings must close. Services can be provided virtually. Personal services such businesses, including hair salons, barbershops, and sites that perform manicures, pedicures, and other aesthetic services must close. Restaurants must close to the public. They may be open for delivery, drive-through, or takeout only. All recreational activities and sports facilities must close. All casinos, museums, galleries, libraries, movie theaters, and concert halls must close. At this time, there will be no change to the K-12 education delivery. Schools and childcare centers will remain open. In part, we are making these sacrifices and changes so schools and childcare centers can stay safe and stay open. In many countries that have gone into second lockdowns, including many parts in Europe, schools have also remained open in those jurisdictions. In addition, we're not seeing widespread transmission of the virus in schools. Despite many cases that are community acquired, we haven't seen that translate into transmission in schools, not at least to high degrees. In addition, some older students have moved to remote learning, and it's even opened up more space for schools to work. Keeping schools and childcare centers open is important for children. It supports their learning and ensures a sense of normalcy for them. I want to thank the teachers and childcare workers for everything that they're doing. Everyone's worked so hard. And it doesn't go unnoticed. For Manitobans, it's now our turn to step up. By reducing our social contacts and focusing on the fundamentals, we reduce community transmission and will keep them safe. These restrictions are really in place to do one thing, to reduce close contacts amongst Manitobans. What we've seen in this second wave is many more contacts per case. We've lost track of those fundamentals. And we know in addition to these restrictions, there's other things that we can do. We can reduce the number of shoppers from your household to the lowest possible number. Send only one person to shop if possible. Work from home if possible. Reduce travel unless it's absolutely essential. And most of all, limit your contacts to your household only. Really live as if you need to list your contacts, because one day you might be required to. Keep a list of those who you've been in contact with, and if we're doing this properly, it should really include only members of your household and possibly some other essential contacts. keep that list with you. If you do become a case, it can help public health contact trace and further limit the spread of this virus. We've been planning for months throughout the summer for this eventuality. Certainly in Manitoba, for many Manitobans, summer provided a sense of calm, but our planning continued. Provincial Respiratory Virus Steering Committee met throughout the summer, and that was chaired by myself and Lynette Siragusa. It was a branch of our original incident command structure. All of that functioning continued throughout summer. And a lot of the progress showed was the plan to address hospital and ICU capacity, continue to improve stockpiles for personal protective equipment, increasing public health capacity such as contact tracing, and we've just seen this capacity increase with the Canadian Red Cross and Stats Canada. They're being trained as we speak. Some Red Cross have already been supporting our efforts in contact tracing. And so we've managed to expand that public health capacity through that planning. We now need to focus on bringing these numbers down. We can take our individual responsibilities to achieve this. If we all work together with us implementing our plans and increasing our public health and healthcare system capacity, and Manitobans taking the lead, doing their part, we'll see these numbers start coming down. To ensure the public health orders are followed and Manitobans are protected, government has granted enforcement powers to cover to over 3,000 provincial municipal personnel. As these restrictions go into place, remind Manitobans that compliance and enforcement issues can be reported to our website or calling our hotline. Outside of Winnipeg, you can call the Manitoba Government Inquiry Line, 204-945-3744, or toll-free at 1-866-626-4862, or simply 1-866-MANITOBA. Press option 3 or visit manitoba.ca/COVID-19 and complete the reporting form. While we want to work together as much as we can, those not following the rules put others at risk. And so we need to know about it so we can further protect Manitobans. The fundamentals still matter. Stay home when you're ill. Wash your hands frequently, cover your cough, physically distance, wear a mask, indoor public places. COVID's proven to be resilient. However, Manitobans are much more resilient. We've flattened this curve before. We've been in this position before, and we saw the success we had, and we'll see that again, just as all Manitobans will step up as we have confidence they will. These next few weeks are going to be difficult for many, and we know that. But this sacrifice over this time will save lives. It will allow our healthcare system to continue to function. And so together we'll prevail against this virus as we have before. And so I just want to thank all Manitobans for your efforts to date, and thank you for our efforts going forward. And thanks, and I'll pass it back to Premier.
Thank you very much, Dr. Roussin, and thank you so much for your efforts. As I said before, we are all appreciative of them. This year has shown Manitoba and Manitobans in almost every respect at their finest. And I believe we can come together now in this challenge and face it together. I believe we can do this thing, and I want Manitobans to know that I think that we can do that together. We've done it in the past on other challenges. We'll do it now too. I want to also say that we recognize the significant personal and professional sacrifices that many, many Manitobans have made in the face of this pandemic in order to protect one another. And I say to those Manitobans, thank you. The new public health measures that we're announcing today and that will come into force on Thursday at 12:01 a.m., I believe, Brent, require the cooperation and commitment of all Manitobans to make them work. And the old analogy about the chain's only as good as the weakest link is true now. We've had 99% of Manitobans on Team Manitoba. We need 100% of Manitobans on Team Manitoba now. I'm a former small business owner, and I want to say to our small business owners that you are the backbone of our economy. And I know that you put it on the line, and I know that many of you have had to close your doors. You've had to lay off staff who you love. You've had to adapt your operations. You've had to rehire staff back, which you liked to do. And you've had to invest in additional safety measures, and you've had to put capital on the line every day. And so to you, on behalf of all Manitobans, I want to say a special thank you. I also want to say thank you to the federal government for coming out with a program, belatedly, that we have lobbied for a long time, that will now support the overhead costs of our small businesses. This is really important to help them stay ready to go and ready to recover, as these restrictions ultimately will be loosened as we beat COVID together. The federal government's program is going to support and help many to get through this challenging time, where many are dealing with great stresses and are dealing by necessity with less traffic, interrupted traffic, fewer customers at their door. A healthy economy has to be part of our COVID strategy. And it is important to understand that in endeavoring to help build an economy, as the Prime Minister has said many, many times, we are also building a healthier society. And we can do both these things together, but for the next few weeks we're going to have to do the circuit breaker, and we're going to have to interrupt the ability to hire more people back and to give people the opportunity that they want to have here in Manitoba especially. We're working people, and we want to have the chance to work. Right now, that's going to have to be interrupted for a time. We have been, since the get-go, working side by side, and we'll continue to work side by side with Manitoba businesses, small and large, to help them do what they do best. Employ Manitobans, offer services and products that Manitobans rely upon. Dozens and dozens of meetings on a weekly basis with groups representatives of workers. Over 100,000 Manitoba workers have helped us to design the programs we've had to date, and they have also given us some input on what I'm going to be announcing right now. Today I'm announcing 4 additional steps that are going to help our local businesses bridge to the future, to get through this thing and come out on the other side strong. These steps will help address what businesses need to get them through to the other side of COVID. Bridging support to get us through COVID and restart stronger. First of all, for impacted businesses that are suffering as a consequence of COVID, and the measures that we're taking today are a specific example of the pain we're having to endure together, we're advancing a new bridge financing program. The Manitoba Bridge Grant is going to provide $5,000 before Christmas to businesses that apply, and it'll provide, if need be, in the new year, if we have to continue with additional measures of restrictions that are going to impact negatively on your small business, an additional $5,000 in the new year, for a total of $10,000 of financial support. I should mention that the Manitoba Bridge Grant program is also open to those who previously received funding from our GAP program, and I'll get into that GAP program right now and say the GAP program was set up to assist those small businesses in our province that weren't able to fit in under other programs initially, like federal programs for wage support, things like that. And that GAP program saw over 10,000 Manitoba small businesses receive about $60 million in direct financial assistance, and that program is going to be changed now. And it's going to be changed from what was before a conditional loan based on the supposition that we didn't want to duplicate what the federal government programs were. So we were giving you a loan, and if you wanted to get a federal program in addition to that that was bigger than $6,000, then it was a loan. We're changing that to a grant. What that means is that you don't have to pay it back. So for the 10,000 Manitoba small businesses, that many of whom, I have hundreds of thank you notes, emails, letters from small businesses around the province saying thank you for that program, that really helped us stay afloat. Well, guess what? Now you don't have to pay us back. So that $6,000 doesn't sound like much to a multinational, but where I come from, that $6,000 really helped and would have helped for my little company, and it's helped a lot of Manitoba companies too. So we're proud of that program. And again, I say all the recipients, over 10,000 of them, of the GAP program, will not have to pay that money back. We know you put it to good use, and we know you will. And thirdly, we have established a wage subsidy program. This program offered 50% up to $5,000 per employee to help people in small businesses hire folks back. It's a very successful program. We had more than 1,800 businesses that applied for that program. They no longer have to provide proof that the funds have been expended before receiving payments. We're going to advance the cash to them. We see the need for increased cash flow in our small businesses now more than ever, so we're adapting that program to advance those payments to you now. Starting as early as next week, we're going to see almost $15 million go out right now to support businesses. These programs combined will continue to offer some of the most generous per capita direct financial support to small businesses in our country. And this will help keep our province at the forefront with appropriately designed programs to support our small businesses. They are the backbone of our economy. We know that we'll never make up for the losses COVID has caused us, whether in business or in our personal lives. No government treasury has that much money in it. No government treasury can borrow enough money to do that. But the fact of the matter remains, we're going to continue to support our small business people because that's the engine of our growth in the future, and our small business people will help us lead into a brighter future as we beat COVID together. Fourth and finally, we are in discussion with our industry and business partners, as I referenced earlier, on a regular basis. But specifically, we are going to be asking representatives of key business groups to give us their valuable input on some additional long-term recovery funding and support programs, which we can then bring into play early in the new year. We're going to continue to take action on additional programming in the new year with a base level of funding of at least $50 million. These measures announced today are not easy measures to announce, and they're not easy measures for you to enact, but they are essential, and I know Manitobans know that. This next few weeks is not going to be easy. But tomorrow, we are celebrating the sacrifices of people from other generations that were far greater. So I say to Manitobans today, I am confident that if we work together on behalf of ourselves and others, as that generation of people did that preceded us, as generations of people did who preceded us, that we can be victorious over COVID. We can get safely through this rough patch we're in if we do it together. The best thing we can do for our businesses, for our healthcare system, for our schools, for our vulnerable communities, for each other, is flatten that COVID curve. And COVID is sneaky, it's nefarious, it's dangerous, and it's fatal. And so we need a team effort now, and all of us have a role to play in protecting ourselves, our loved ones, our community. When we were abiding by the fundamentals, we were beating COVID. Now COVID's beating us, and we need to get back to the fundamentals and flatten the COVID curve. And we need to do that now. Lorsque nous respections les fondamentaux, nous battions COVID. Alors certains d'entre nous ont perdu notre chemin. Et maintenant, COVID nous bat. Nous devons revenir aux fondamentaux et éclater notre cœur COVID maintenant. It's crucial that we follow the fundamentals. We stay home when we're sick. Stay home when a member of the family is sick. Wash your hands. Practice good hygiene. Cover your cough. Practice physical distancing. Wear a mask. Limit your close contacts by 75%. And get your flu shot. Thank you. We look forward to your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first, from CBC Radio Canada, Laisa.
Bonjour, Monsieur le Premier Ministre. Yesterday, he has been a lot about the vaccine, talking nationally, and Canada has been announcing that they're buying vaccine right now. And the question is to know if, let's say, after that, we will need to distribute those vaccines. Talking about the resources, we have the logistic now to ensure the distribution of vaccine in provinces, or we will need the Army has the USA.
2 points on the vaccine, and Brent, I'll let you pitch in if you like on this. First of all, it takes time. Don't let your guard down because you think there's a vaccine right around the corner. It takes time for this process to happen. It's going to take months and months and months. Don't let your guard down. What we're announcing today is essential. We have to follow this to bend the COVID curve now. We don't have a vaccine. Vaccine's in testing stage here. So please, Manitobans, understand. Don't let your guard down. As far as the coordination with the federal government on vaccine availability, they control the purchasing of the vaccine. We have input into how it would be prioritized on availability. We all understand it must go to vulnerable people and frontline healthcare workers first. Beyond that, we're in discussion. I had discussion with the Prime Minister about this last Thursday. Other premiers will have input as well. But Brent, over to you if you have additional thoughts.
Sure. Yeah, thanks. I mean, I think that, we can be cautiously optimistic with some of the reported results of the vaccine. Certainly, we'll be prepared to receive vaccine when it is shipped to us and be prepared to distribute that accordingly. But we all know that early on, those first periods of time when we have that vaccine, it will be in low quantities, so we will have to prioritize it. And so we will be dealing with this virus for quite some time. So we do have to focus on what we do now, and we can remain cautiously optimistic that a vaccine will be coming.
Mm-hmm. And now talking about the measures that you announced today, do we know how long those restrictions will be in place? And also, will dental clinic, massage therapy, physiotherapies will have to close also?
Mm-hmm. Yeah, as far as the duration, I think we need to prepare to have these in place for 4 weeks, 2 incubation periods. But of course, we always are reviewing things, and we'll continue to review that. As far as therapeutic businesses that are self-regulated, including massage therapy, they will be allowed to continue to operate, but under the guidance of their regulators.
From CBC Manitoba, Bart.
Dr. Roussin, can you go into the exemptions on the, talking about socialization specifically, but just because people are easily confused, can you please state about home care providers, other people who help elderly people living alone in their homes, the kinds of people who can visit people's homes? Can you make it entirely clear, please, in your messaging that this zero socialization is for socialization only?
Exactly. This is to reduce social visits. Certainly, home care is run through the healthcare system and will be adjusted accordingly if necessary. But this is again, we want people to stay home as much as possible. We know that there are certain things such as family members providing childcare, or family members or friends providing service at home to people. This is not what we are addressing here. We're talking about social visits, need to be your own household. We're talking about essential purposes only, and that's really what we need moving forward.
Thank you very much for that. Slightly off topic, Mr. Premier, do you still have confidence in Revera to keep personal care home residents safe?
Deeply disturbed about the misleading communications, partly in respect of Revera, and tremendously disheartened by that. And I know that the health minister's announced immediate actions that are being taken, and will continue to pursue every manner of improving the quality of care for seniors throughout the province. We have close to 150 personal care homes. Most of them, fortunately, have done a tremendous job of protecting their people, and even during the COVID breakouts that have existed in a number of them, have stepped up but misleading information is inexcusable. Doesn't demonstrate the responsible behavior of the vast majority of our personal care home managers.
From the Canadian Press, Steve.
Dr. Roussin, given the high test positivity rate and given what I see as an increasing number of unknown sources of transmission in the weekly epidemiological reports, do we know how this virus is spreading anymore? Will a lockdown contain it with numbers that high and that widely spread?
Well, I mean, that's exactly why we need these measures, is because of those things you listed. When we, early on, say in Prairie Mountain Health, we knew exactly where it was being spread, so we could do a targeted intervention. Right now, like you say, our test positivity rate is up. We're seeing a lot of community-based transmission. So now the target is we just have to reduce contacts, period, no matter where they are. And so certainly the high-risk areas are where people gather outside of their household for prolonged periods of time. But we've lost that ability to target our approach. That's why we need these widespread restrictions, which will result in just decreasing the amount of contacts overall.
And a question for the Premier. Given what's happened at two Riviera care homes in recent days, Premier, is the province going to do more than simply boost monitoring? Are there investments that can be made to make care homes safer? Because, as you know, once the virus gets in a facility like that with so many vulnerable people, it tears through there pretty quickly.
Yeah, that's quite true. And we know that we're not immune from the realities of these challenges. This is going on not just across Canada, but around the world as well, with the nature of concentrated housing. But the fact remains, of course, too, that our seniors are some of our most vulnerable people to the symptoms and to COVID itself, as we've sadly seen. So, yeah, the health ministers had already announced additional measures of inquiry, and we have, as you know, Steve, maintained the highest or second highest level of funding overall for health care in the country during our time in government. So the investments that are necessary will be made and have been made.
From CTV Winnipeg, Jeff.
So, hi, Mr. Premier, Dr. Roussin. I'm wondering, for people maybe say living in Prairie Mountain, I'll ask the devil's advocate question. They might say, well, you know what, our numbers are lower here. Why are we, getting lumped in with everybody else? If you could maybe explain the rationale for going red province-wide.
Yeah, and so there's a number of things. One is that the test positivity has climbed in all jurisdictions. Yesterday in Prairie Mountain Health, it was over 4%. And so we do see the trend, in the wrong direction. We still see the number of contacts per case in the wrong direction in all of the regions. So we see that trend is going in the wrong direction. In addition, we're seeing that strain on our healthcare system. So we have to do whatever we can right now to stop the climbing numbers, because it doesn't really matter where in Manitoba the cases end up being. If we have 300 cases, a certain proportion of those are going to be hospitalized, and another proportion of those are going to be in ICU. So we have to do whatever we can right now to reduce the transmission of this virus, and the province-wide approach is that step we need to take.
And I have a question on business here. You mentioned earlier that some businesses, like massage therapy, will be allowed to open, while others, like hair salons, barbers, manicure, they must close. Why the difference there? Because you get close contact with another person. So why the difference there?
Yeah, so these are the largely regulated health professionals. So they're regulated by their own regulators, and so we were relying on the safe practices that way. So again, it's the balance. Do we want people to still have access to some therapeutic support? And these are, like I say, self-regulated bodies for the most part, and so that's where we'll leave the regulation.
From City News, Stephanie.
Hi there, Stephanie Lassu from City News. I'm just wondering, from the virtual town halls that you guys have had and the surveys that you sent out over the past week, is it your sense that people actually will call enforcement on their neighbors, their friends, if they see this happening in the community? And is that the first thing you would recommend they do instead of talking to them first?
Well, we're all in this together, and I would argue as this has been miscategorized as somehow for informants. It isn't. It's publicly minded individuals who are trying to help with compliance. We had 13,500 tips called in last week, 30 additional warnings, 12 tickets were issued. We'll have more to say on additional enforcement measures later this week, but as I said last week, and I'll say again, we're dependent on all of us not being the weakest link here. I will only tell you that this is the most significant number of tickets and the highest financial penalties that we have had since COVID began last week. $5,000 fines given out in 9 cases of infractions by businesses. In addition, individuals on a variety of infractions as well. And we'll be having more to say on additional enforcement here. Most people are doing the right things, and now with Dr. Roussin's additional instruction and these requirements that we have brought out here, we have a chance to bend the COVID curve, but we need everybody on the team. And if you don't want to be on the team, be prepared to pay for it.
Okay, and how will enforcement actually work? So an officer shows up to a house to enforce the new rules. Does everyone in that household now get a ticket? Is it just people who were the hosts who get a ticket? How does that play out?
Well, quite frankly, with hundreds of people engaged in enforcement, it's our hope that it'll play out to the detriment of those who would break the rules and would give COVID to themselves or someone else. Quite frankly, what we need here is a deterrent to that type of behavior, and so that's the nature of enforcement. The less I say at this point, probably the better in terms of how we're going to go about enforcing, because frankly, I don't want to give a heads up to those who might try to get around the enforcement. So I'll simply say there's going to be more enforcement. There's going to be more tickets, sadly, if people choose to break the rules, and we're going to make sure violating the rules. Now, in saying that, we all understand as well that some people, and I do not wish to stigmatize all Manitobans here, some people have been part of spreading COVID inadvertently, not knowing they had it, not, with asymptomatic situations that have existed. So this is why the measures that Dr. Roussin has outlined today are so critically important, so that we limit our number of contacts. Brent, maybe could you elaborate further on why that is so critical in this situation?
It's certainly that. I think there is a lot of discussion as epidemiology becomes a focus of a lot of people's learnings. The R value, the basic reproductive value, the average amount of people that a single case passes it to. And we all can recognize that if that is less than 1, then the virus goes away. If it's more than 1, then it escalates. And so what we're doing here is just limiting those contacts. And so if we do it in every setting where we limit the amount of people we can be in contact with, if we isolate people who are contacts, then that number goes quickly below 1, and the virus starts flattening like we saw in the first wave. So it's just imperative that we reduce the amount of contacts that we have at all times.
From CHVN, Taylor.
Hi, good morning. Premier Pallister, seeing as today's announcement is quite heavy and emotional for all of Manitoba, how are you feeling about calling these new restrictions?
Well, Taylor, that's a great question. How am I feeling? I'm feeling so sad at the loss of so many Manitobans. I can't begin to describe to you. But I'm feeling good about these restrictions because I know Manitobans will get behind these. And I believe in Manitobans, and I believe that they can beat COVID. But we need everybody on the team, and we need everybody looking at beating COVID, not looking sideways and trying to blame somebody. I used to play a lot of sports when I was a kid. Long time ago, I was a kid. I remember we went through some losing on our teams. You learn as a 10 or 11-year-old that you don't start blaming everybody else when you have a tough time. It doesn't help. So when I say get on the team, I mean it. Manitobans have a chance to point fingers and blame people like Dr. Roussin or me, and that is unproductive behavior. We're open to criticism always, and we accept that, but we have one leader over here. We don't need 600,000 people pretending from the stands that they know more than he does. So I'm asking people to get behind our healthcare leaders, support them, be productive in their behavior. As most Manitobans have been, be kind, be considerate, be gentle. Everybody's afraid, everybody's stressed. And the way to deal with this is not to panic, it's to have a plan and follow it, and that's what we're outlining today.
Thanks for that, Premier. Dr. Roussin, why were churches being asked to close for physical in-person services?
Well, I mean, I think it's just the nature of that setting. We know that this virus spreads indoors, prolonged contact. And so we've seen a number of businesses, when we talk about bars and restaurants and now faith-based gatherings, it's not necessarily, purposely targeting those sectors, it's targeting the virus. And so we know that we're still seeing a lot of contacts per case. We have a very high test positivity rate. And so we just have to, right now, decrease where people can gather outside their households. And so just like many other settings, those faith-based gatherings are subject to this.
From the Winnipeg Free Press, Carol.
Good morning. Premier, you said just a little while ago that the province will continue to pursue every manner of improving the quality of care at personal care homes. What do you think would be the downside now of asking the military for help at personal care homes?
I think that it would demonstrate a lack of faith and confidence in the people from Manitoba who we put in positions of leadership here to guide us through this pandemic. And so I think it would be a mistake to cast aspersions at the folks like Dr. Roussin and others who are leading our healthcare efforts here, because they are doing their absolute best, and I will demonstrate faith in them.
We've heard that there's been all kinds of planning that took place over the summer in Manitoba to prepare for the second wave of COVID-19. Why haven't those plans worked to keep personal care home residents safe? Nobody's blaming the doctors, but why haven't those plans been effective here? Quebec and Ontario have managed to avoid the tragedy that they saw in the first wave, in the second wave. Were the plans implemented too late here?
Well, a couple of things. First of all, Quebec and Ontario have the highest case numbers in the second wave in the last week that they've ever had, Carol. So I would say everybody from probably close to the Bay of Fundy to the Pacific Ocean is experiencing the second wave in a similar way. In part, I think our success early on didn't condition us to the realities that hit most other jurisdictions across the country from coast to coast. And so now we're dealing with the shock of this upturn, perhaps with, in some cases, more stress than other people because they'd already been through it with the first wave. That being said, the criticism that our health leadership, our elected and non-elected health leadership, hasn't been at this every step of the way every day is wrong. The incident command team comes into being when there's a lockdown. We had an incident command team, we had a spring lockdown, we have an incident command team now. But the leadership of the incident command team is the leadership of our provincial respiratory virus steering committee. That's Dr. Roussin, Lynette Siragusa, and the same people. The difference in the two structures, I think, and what's missing from the comprehension so far of commentators who use this as some piece of false evidence that there wasn't work going on through the summer, is they don't understand that these are the same management teams, both these committees. When there's an incident command issue, we go deeper into some of the departments to create additional contact. But the same leadership that provided us with quadruple testing capacity through the summer, as we planned and ramped up our testing capacity, is the leadership that was in place during the preliminary shutdown and now. Testing sites that opened, wait times for bookings come down dramatically, working with local manufacturers on PPE, most PPE categories 1 year supply now, 149 ventilators purchased since March, ICU planning, color-coded pandemic response system, first of its kind in Canada. Ontario just put out theirs last week. It's a photocopy of Manitoba's, a result of the management and leadership of Manitobans working together throughout the summer months. And co-visitation shelter planning. I'll give you that as one specific example, Carol, of an outcome that we now are going to have into the winter months that's going to assist in helping make sure our seniors are able to see family and friends safely. That took months of planning. So, Brent, do you want to add anything to this? Because I know I'm reacting to this, but the suggestion that we haven't been working or diligent when every jurisdiction around the world is dealing with a massive my lecture for today on that topic.
Yeah, I would just say that, I mean, the incident command structure is designed for, for short-term periods to function in a way to uniform decision-making throughout, a large sector. It's not meant to be sustained over long periods of time, and so it's quite the usual and that you launch up the incident command when as soon as you can leave that structure, you do so. But of course, we just transitioned from that structure to the provincial respiratory virus steering committee with that same leadership, knowing that we may need to reinstitute the incident command as soon as we saw increasing numbers. So the planning, the work continued, just under a different structure.
From Global, Marnie.
Good morning, Marnie from Global here. Mr. Premier, at the start of the press conference, you thanked the federal government for their support. My question is that support enough, and what else would you like to see Ottawa do to help curb the spread of COVID here in our province?
Well, the initial responsibilities are ours, as Brent and I have accepted at 150 press conferences and various other ways. I'll just say this. I sincerely thank the federal government and the Prime Minister for their willingness to be open. We've had dialogue. We have calls almost weekly with the premiers and the Prime Minister. I have calls privately with the Prime Minister very frequently. When I disagree with him, I tell him that privately. So I won't be elaborating too much on the pandemic on where we disagree on other issues. We agree on many things too. One of the things we agree upon, most certainly, is the need for us to have continuous best efforts working together. And so I encourage municipal officials to do that as well. And I thank the vast majority of municipal officials for their willingness to step up and cooperate. I have noted that on the enforcement side, we now have equipped municipalities to be able to do even more at the local level, because this is a grassroots effort too. It's not just a national effort. Specifically, I did reference earlier, and I'll say again, although belatedly, the federal government is now stepping up on overhead help for small businesses, for their rents, leases, and so on. That's really important. And it's something we had urged. Some of the other premiers supported me in this effort, and we most certainly have urged the federal government to step up on this and have a national program that makes some sense. Previous one was less effective at getting the money to small businesses when they needed it, and so I'm pleased with that. And I thank the federal government for their willingness to be communicative with us on a variety of fronts.
Thank you for that. And my next question is for Dr. Roussin, just on a slightly different topic. We're hearing that in schools, in terms of contact tracing, it's being conducted by principals. Can you confirm that? What do you know about that, and why would that be happening? Is it due to lack of staffing or people available for contact tracing?
Well, it's collaborative. Right, so we have a case in the schools. Certainly, our public health nurses are investigating, but who knows the cohorts better and the function, the inner workings there. But the leaders within the school. So it's certainly collaborative there, that was essentially how it was designed. That's how our public health nurses can get valuable information. So I think that right from the beginning of this year, we saw cases, from the community quite early in schools, which was anticipated. But the work of the leaders in the education system has just shown that despite the amount of cases we've seen there, transmission has been limited within those schools. So, my hats are off to the leaders in the education system, because they've really stepped up here.
From the Brandon Sun, Kyle.
Good morning, gentlemen. And you may have already answered this question, but I thought I'd just ask it again just to confirm. How long will these critical red restrictions be in place at a minimum until there's the potential to relax them in certain regions of the province?
I think the message is we have to plan for these to be in place for 4 weeks, which is the 2 incubation periods. Public health, the Public Health Act, the public health measures always require us to use the least restrictive means. So we'll always be looking, reviewing these to have them in place for the least amount of time that's necessary. But we should plan for 4 weeks.
Best Christmas present we could give each other is to just do what Dr. Roussin said. Get on Team Manitoba, do the best we possibly can to limit our contacts over the next few weeks, and then hopefully we can get where we need to be in terms of bending the curve on COVID together.
Thank you. And outside of the northern travel restrictions, as I understand it, Manitoba residents can still travel between health regions. What advice would you give to these people who want to undertake this kind of travel within the next 4 weeks?
Our advice is clear. Non-essential travel is discouraged. Right? Our message is stay home. You should only have household contacts except for essential reasons, and all non-essential travel should stop.
Our final 2 questions come from Scott of the Winnipeg Sun.
Good morning. Yeah, it's still morning. Good morning to both of you. Question for the Premier, and going back to talking about what hasn't and hasn't been done, what people have said. Surely you can understand why people would think not enough was being done when people now see a second, an out-of-control second wave, PCH is overrun with the virus, hospitals on the brink of overcapacity, and just very little information coming from the province until we were already in red. What is the message to people who don't think that there has been enough transparency until it was essentially arguably too late?
Well, my message would be that it's understandable that people are stressed, and that there's a tendency sometimes when people are stressed to look to blame in any number of ways. I would say this: if we're going to beat COVID, we're going to do it together, just like we did all summer. So let's stay on that and stay focused on that. And if we can do that, then we'll, as I said earlier, we can give everybody the best Christmas gift I think I can remember in my lifetime by flattening the COVID curve.
And my second, or just my follow-up, why are large, like multinational stores like Walmart, Costco, Superstore, they're all allowed to sell non-essential goods, but small retail businesses are asked to close that would sell those same goods? Why aren't some of these businesses allowed to stay open that can't compete with these bigger chains that are allowed to stay open, seemingly because they can sell pharmacy and groceries?
Yeah, it's a good question, Scott, and I'll just start with this. The programs that I announced today are designed for exactly the companies you referenced that are smaller and disproportionately impacted by these restrictions. So that's why for many of those companies, they'll have if they're one of the 10,000 that already applied for that gap financing I referenced before, they get 6,000. Potentially, they could get an additional $10,000. Plus, they've got the wage subsidy program, which could allow them to claim 50% of the wages for their employees when they're able, if they haven't already, when they hire them back, or if they did already claim for it, they'll get their money advanced now. We're talking about potentially for our small businesses across the province, upwards of $100,000 if they're a mid-sized 10, 20 employee company, or if they're a mom and pop shop like my little company used to be, then they're talking about potentially $25,000, $30,000 for those that size of company. So the benefits are there to help bridge through to get beyond these restrictions. And I'll let Brent answer the issues that you referenced on the big outfits you referenced in your preamble.
Yeah, and so, I mean, these are challenges whenever we're writing these orders. I think it's clear that we have to keep critical services open, that's selling critical things like groceries, and then certainly when it comes to places that have multiple things that they sell, then you run into some of the inconsistencies like this. But the messaging is clear that Manitobans should be going out for only essential purposes. So should really be only going to those places for the essential things that are being sold there. Really only one family member going out. So we just have to do whatever we can to ensure Manitobans have access to critical needs, but at the same time reducing our contacts overall.
I'll close by quickly saying again thank you to Dr. Roussin, and to also say I've asked for, I've never seen as many Manitobans outside on a November Sunday as I saw this Sunday, and we all know it was a freakishly warm day, and we were taking advantage of that. But it reminded me of how critically important it is, as we follow Dr. Roussin's guidelines, that we also remember about facing up to the challenge of getting outside, doing things that are physically going to allow us to be active, that will help our spiritual well-being as well. These are important things, so I've asked our health minister sit down with Lynette Siragusa, come up with some suggestions and recommendations to help coach us through this time. It's not going to be an easy time, but it's going to be a time we can face together, just as our veterans made sacrifices for us, and we'll be honoring them tomorrow. We're going to have to make some sacrifices too. Every generation has their challenges. For many Manitobans, this will be the biggest challenge they've ever experienced. Other generations experienced even greater challenges. So let's pull together and be part of Team Manitoba. We can get through this thing, and we can turn this curve. So let's do it together.